Great. Okay, well, we will go ahead and get started, and I'm just going to keep an eye on this Zoom in case Barb does pop in here. Oh, hi, Randy. Okay, are you good with minutes?
Disclaimer, I'm going to use Otter AI to take a recording of our thing, and then it'll auto turn it into minutes later. If that's okay with everybody? Cool.
And then it'll get passed over to Laura for review.
If it's not okay, then you can you're the secretary. Because I hate this job. I'm awful at it.
Okay. So maybe we'll just, for the purposes of this, we'll just say who's present here in terms of board members. So we have Randy Morris, Laura Weir, Carmen Stagmiller, Gary Dale, Ken Bassman, Sam Carlson, and then in addition to that we have public health staff, Brianna Lindgren, Austin Moyer, Katie Adams, Melissa Moyer, and then Melody Martinson is here with the Acantha. And that will help. Okay, so I'm sorry, I put the wrong minutes in my thing, so I don't have the agenda, but it's right here. Randy, if you need a copy of the agenda. Okay, so first order of business would be approval of the March minutes, which thank you, Austin, for making those happen. Did anyone have any adjustments or corrections?
Look good.
Can we make a motion to approve?
Yes.
Okay.
I'll second.
Great. All in favor?
Aye.
Opposed? Okay, perfect. Minutes approved. And Laura, I'm going to let you sign off on this since you were the new secretary. And then you can pass that down to Ken. You're signing 2 copies. Okay, I didn't have any old business on the agenda. We can move on to new stuff. Laura's going to keep testing pens here until she finds them.
And I'm trying to ones that aren't working.
Just put them back
Oh
in
my
there.
gosh.
It's what everyone else does, right?
I know the county's not real flush right now, but yeah. Thank you.
I'm going to sign that one too. Okay, so we will start. Laura has graciously agreed to provide us with a brief update on the legislative session as it relates to public health. So you can, and I have some copies of at least the first few pages of a summary. I didn't probably make enough for everybody, but you guys can pass those down.
So when I volunteered to give a brief update of what happened this past legislature, I based that upon the experience that I had when I used to be the executive director of the Montana Public Health Association was after I retired and was very involved in the legislative process when it was in session, and I based my willing or saying, hey, I could do this for you, based upon that experience. Well, a lot of things have changed since that, and one of them is that the 3 public health associations in the state of Montana have joined together. They still have their own identity, but they are under the auspices of, if you were to look at this document that was just sent around, it's called Confluence. And so they all work together to promote certain things and enhance public health through the state of Montana. It's the Montana Environmental Health Association, which is the association of all your environmental specialists. It's the Montana Public Health Association, which is an organization that anybody who's interested in public health can join. But most of the members are like the Department of Public Health, the Montana State Department of Public Health, local health departments and their staff and that type of thing. And then we have an Association of Montana Public Health Officials called AMPO, which is just the lead public health associations. So about the time that I resigned, they all got together and said, we're going to work together. We're going to improve our communication and so that we could have more of an impact legislatively. And they hired a executive director to be the executive director of all three organizations to enhance coordination. So anyways, they have done a heck of a job of having more of a legislative presence and pursuing different legislation. So when I volunteered, it said, hey, I could give a legislative report. I'll just contact this organization because I'm a member of it and a member of MPHA, and I'll ask them for their report. And then I looked at their report on Sunday, getting ready, I was planning ahead, getting ready for today's meeting. And it was 16 pages long. And so the first couple pages are just information about what they did and what their priorities were and that type of thing. And then through page 4, and then from 5 to 16, it was every piece of legislation that they were involved in what capacity. And so I thought, oh my God, I contacted Melissa. Well, first I contacted Melissa and said, would you print this off so I could hand it out? And then she got back, we had a conversation, and she goes, the board doesn't like a lot of paper. I said, I can understand that because this could be kind of dry. And so I said, I can't go through all this crap no, it's not crap, excuse me. I can't go through all this in the time that I think it's going to put them to sleep. So anyways, I had to kind of readjust, and I wasn't involved in a lot of this. And so I had to readjust what I was going to say to you, and I asked for Melissa's help because she was probably more involved in this than I was. But I will say that I'll just go over the specific policy achievements that happened during the legislature based upon all these bills that they either opposed, supported, or were neutral on. And I think Austin is going to talk about this first one, House Bill 853, which is revising the fees for license establishments. Okay. The second one is holding off rollbacks of immunization protections, and there was 1, 2, 3, 4, 5 bills that addressed this particular category. And I just want to say that when I was the director of the Teton County Public Health, Teton County Public Health Department, one of the bills that kept coming up, and I see that it still comes up, just to give you an idea of immunization protections, is to enroll your child in a Montana daycare center, a registered daycare center. You have to meet certain immunization requirements, or you can't enroll your child in that type of center. If it's just a woman who volunteers to babysit, it wouldn't affect that individual. And the reason for this is there are some mothers who want their child protected against immunization diseases that they can get an immunization for and be protected against. One of them, the most common one, is probably pertussis. And so when your child is an infant, they will need to get at least 3 vaccinations, and you can correct me if I'm wrong, to get a level of protection, and it's usually given at 2 months, 4 months, and 6 months. And so it takes a while for that baby to be protected. So you have a mother who's enrolling their child in a licensed daycare center, thinking that their child is going to be safe. What certain legislators want to do and what certain members of the population want to do is remove that requirement that babies have to get immunized for these diseases. And so if they were able to remove that requirement, then a mother could enroll her child in daycare, a licensed daycare, and that child could potentially bring whooping cough to the daycare and expose the infant whose mother is trying to keep that child protected from whooping cough. And this bill keeps coming back, and what was the status of that this year? What happened there?
Well, so specifically around immunizations and childcare, that was actually changed in the last legislative session, but it didn't take effect until after this most recent legislative session. So essentially what it does is it changes the rules around, there's certain, depending on the type of childcare license, some are required now to accept religious and medical exemptions. So you have this required exemption ability to, childcares are required to exempt children into their, not all of them, some of them still have a choice in the matter, but some types of childcares are required to accept exempt kids. So that went into effect. They had the opportunity to try to change that legislation. There were some bills that were proposed that would change that so that all childcare facilities would have a choice in terms of their decision around bringing in exempt kids, but that did not pass. So as it stands now, some childcare facilities are required to accept exemptions.
So potentially putting infants at risk. I'll just quickly give you an experience of mine. So we had a pertussis outbreak in Teton County, and it took about 3 to 4 months. It was mainly in the grade school population, and we were involved in it about 3 or 4 months, and we were getting to the end of it, and I was just frustrated, tired of telling people what they could do, responding to their anger and questions and things like that. And I had this mother call me, and her son was a senior in high school. He was wrestling at the state tournament. She was on what's quarantine? What's that? She wasn't quarantined. She was isolated. She was on isolation because she had been exposed. That's still right. She had been exposed.
Quarantine would be if she'd been exposed. Isolation if she was sick.
She was quarantined, and she calls me up, and it's her last day. It would have been her last day of quarantine. So her son is wrestling in the state championship. He is going to wrestle for the championship. And she was wondering if she was on her last day, she was wondering if she could go down and watch him wrestle. And she said, I'd wear a mask, Laura, I'd only go in for this wrestling and things like that, or his match and things like that. And I said, oh gosh, I really would like to, but let me think about it. And I really was getting this close to saying, go ahead and go. So Laura Shelton, I don't know if you guys remember Laura Shelton, she was a medical doctor here in Teton County, and she was the health officer. So I had her come over to my office, and I was explaining this situation to her, and she said, and I said, well, what do you think, Laura? And she said, she looked at me and she said, Laura, we have a baby in ICU with pertussis fighting for its life. We're not going soft now. And I thought, you're right. We're not. And I called up the mother and said, I'm sorry, but we can't, let you go. And she was really, really nice about it. But that moment was it made, what we're doing so, important. And sadly, that baby did not survive. So that's what happened there. And then there was legislation that strengthened and preserved the Montana Clean Indoor Act.
And Brianna actually is prepared to talk about that today.
Yay! It was during when they put that in place. It was, yeah.
Yeah. Do you want me to talk
yes,
about it now?
Please.
Okay. SB 390, we're really excited. We've been working for several legislative sessions to include vapes and e-cigarettes into the Clean Indoor Air Act. And that just got passed this year. It was signed into act on May 15th, I think. So The state's not prepared for it to pass, unfortunately. So we're working at the state level to get information and signage and press releases. So the next step will be educating the public and educating business owners and working through that. But it's really exciting to have vapes and e-cigarettes included in the Clean Indoor Air Act. From my experience, I haven't seen it a ton that people are vaping or anything inside. There's a lot of businesses that have things like that in place, and obviously like the high schools and stuff, they're tobacco free. But it'll be good, especially on the multi-unit housing level. That'll kind of transfer over a little bit, make it a little easier to include e-cigarettes in those policies as well, and that'll be part of our conversation as we move forward with this. But yeah, I'll be talking to businesses and educating them on why it's important and the signage and all of that as soon as the state gets anything to us. So
Thank you.
yes, it's in effect now. And like I said, I haven't seen a ton of like vaping in public spaces. I think most people have kind of self-policed that in a way, but it'll be good that it's officially in place and that conversation's there and easy to report and follow.
So what happened with the bill where they wanted to allow cigars?
I haven't followed up on that, but it didn't pass.
Oh, good.
But they've been trying the last couple years to include, so they've changed it a couple times. Last session, it was making cigar bars a thing again. And so allowing anyone to smoke cigars in an establishment that sells cigars, alcohol, those kinds of things. They would be establishments that you have to be over the age of 21 to be in the first place. So that was their excuse on why it would be okay. But protecting, anyone that's in that establishment, and then especially the workers and stuff that have to be there all the time. And then this year they tried to change it to, the previous issue was that, a bar that's attached to housing units or a bar that's attached to other facilities, that there could be some shared air there. So this year they came back with a bill that basically said that it would have to be an establishment off by itself, not attached to another business. And it didn't pass, but there was a lot of conversation around it. They were really working on it.
I was asked to contact, I'm losing my mind. The guy, who's our senator, lives in Shelby.
Butch Gillespie.
What?
Butch Gillespie.
Butch Gillespie on that, and I did, but I wasn't sure whatever happened to it. Thank you. And then the other last bit of legislation was House Bill 658, which that has to do with revising local boards of health, sanitation, power, and rules. Will you be discussing that at all?
I wasn't planning on it.
Oh, no, okay, so it would have removed local counties' ability to adopt more stringent on-site wastewater treatment rules than those set by the DEQ. Was this a victory, or did it?
It didn't pass.
It didn't pass?
It doesn't really factor into Teton County as much. We just go with the DEQ's requirements.
So those were their particular policy achievements, not necessarily their what they really wanted to do, but that's my smaller report.
Great.
And if anybody
And I did email the full 17-page document to you guys if you want to read through what happened. And they did a nice job of
they did
kind of putting in a little key here about what Confluence Alliance supported, monitored, opposed, and then it'll tell you exactly what happened to that bill. So.
Yeah, it like I said, public health and its presence at the state legislature has really improved over the since I was, like I said, executive director of the.
And I will say there's also a lot more public health related legislation coming up than there was back when you were doing it. At post pandemic, there has been just a lot of movement to I mean, there were some really great wins this year for public health, but there is also a lot of essentially attacks on public health authority. So, and that is a pretty common thing that we're seeing now.
And tobacco, that was a very short blurb of all the tobacco related legislation that came through this last year, and thankfully some of the big ones just got tabled.
Yep. Yeah, but absolutely, attacks on Clean Indoor Air Act and all kinds of things. So it was impressive that they came through with this one to include.
Yeah, it's kind of a surprise to everyone that it passed.
So anyway, if you guys have any questions about any of this stuff? Okay. Well, feel free to read through it, and if you want to bring anything up at a future meeting, you sure can. Okay, I'm going to jump ahead then. I'm going to let Claire go because she has to get back to hop on a conference. But so I just thought we could talk a little bit about the new near-term initiative grant that Teton County was awarded, and I brought up the task order with the list of activities here. But do you want to talk about it first, Claire?
Yeah, and then I also see the crisis.
Yeah.
So Teton County was just awarded the near-term initiative grant, the Future Generations grant from the governor. So it's $250,000 over the next 2 years. That's specifically for behavioral health. And there's two options that we could have gone. There is a community health worker, and then the community-based one as well, the coalition-based. So we went with the coalition-based as opposed to the community health worker. And so that's just going to help us with our funding and be able to do a lot more around behavioral health with our coalition and just within our county as well. Did you want to?
Yeah, so this was the Future Generations money. That's that $300 million that the governor set aside to address behavioral health in the state. That pie of money got split up many, many different ways, and one very small slice of it came to public health, and there was a big push to make health departments sort of facilitators of the conversation around behavioral health in their communities, to put them in a role where they could help organize and bring various partners together to discuss mental health, substance use disorders. They put out this RFP. It was available. It had to be counties less than 10,000 people, and they were taking the first 10 that got their applications in. So we're very excited that we got our application in quickly. So we have been doing a lot of this work in behavioral health since 2017 is when our behavioral health coalition, we started it, our Teton County Cares group. And so I think in a lot of ways we're actually a little ahead of many of the communities that are receiving this funding. But this is really the first time that I feel like we've been funded in a significant way. So $250,000 over 2 years to address behavioral health is a really big deal for us, because we've been talking for a long time about, well, we could try this or we could do this, but we haven't had any money to back us up, or we've had enough money to have a coordinator in place, but really nothing else, right? Mm-hmm. So it's a big opportunity for Teton County to sort of move forward with the work that we've been doing for a long time. Behavioral health, mental health, substance use disorder continue to come up in any type of, like, we just did our community health assessment and our community health improvement plan. And again, when we're picking priorities for the county, the people pick behavioral health. I think it gets widely recognized as a big issue. So I don't know if we know exactly what the outcomes of all of this are going to be, but we're really excited to be in a great moment to push and to move forward with some of the work we're doing around this. As part of that funding that we receive goes to the Montana Public Health Institute to provide technical assistance. And so that's a fairly new organization in the state. They've been around for 6 years maybe now. But it is full of really incredible folks that will be helping us move forward and stay organized with this work and kind of, strengthen and build these collaborative systems.
So one of our first steps is next week we are going to have Jennifer McCauley from the Montana Public Health Institute come and talk about the near-term initiative grant to the Behavioral Health Coalition, the CARES group. We also are going to start updating our strategic plan. That will hopefully be in August, maybe September. It depends on what Jennifer's availability is. But we are going to bring that up to the group next week. And we are hoping to have as many people as possible join that strategic plan meeting or meetings if we can have two, because that's going to kind of show us where the work around behavioral health is going to lead and see what it is. Yeah.
Do you have dates?
I don't have dates yet, but next Thursday, the 26th, is when Jennifer is going to be coming.
That's our monthly standing CARES meeting. It's from 1 to 3 here.
Yep.
On the 26th.
And then we'll be moving the CARES meeting to 9 a.m. the second Tuesday of the month starting in August. But Jennifer will hopefully have dates for us in the next couple weeks. And then I will let everyone know and I can add you in that email.
So behavioral health is a large...
It's a very broad term, and I think that they use it because for a long time when you talk about mental health, there's a really big stigma and taboo around it. And so I think they were thinking maybe behavioral health is a more softer, encompassing term, but really it's anything that has to do with, you think about behaviors, right? It's in the term. Mm-hmm. So anything that's mental wellness and resiliency along with maybe mental health issues that we're seeing.
And substance use.
And substance use. Substance use with tobacco, alcohol, drugs, anything. It's just including everything.
Mm-hmm. So will you, as a result of this meeting and then moving forward, will you kind of narrow that down to a specific behavioral health or a specific focus?
There's going to be some, there's going to be focuses and there's going to be goals that we're hopefully going to be able to identify rather quickly. It might come in terms of education and trainings, either to bring to healthcare workers or first responders or community at large. It might be things for the school because this is encompassing everyone, all residents in Teton County. So it's not just for youth, it's not just for adults, it's going to be for both. Bringing part of what they want to see if you look on the screen, like there's certain things where identifying community coalition to inform work. So like some of it is adding more, bringing more people to the coalition who might not be there. So when we look at our coalition, it's who's not there to represent different groups. So we're looking at like maybe having more religious leaders come. We have quite a few people in like the medical and first responder area, which is great. We have commissioners who come. Law enforcement is hit and miss because it just depends on what they have going on and their availability. But it's trying to make sure that we have all the partners at the table who are representing right at large. Through them, we can identify where we need to be focusing. So yes, I'm hoping that with the strategic plan and then the chip that we just did, it'll help us narrow down. It's exciting that we have a lot of money, but it's also trying to figure out like where it's going to be most beneficial and impactful. So if any of you can make it to those strategic plan meetings or the CARES meetings, the monthly CARES meetings, that would be great because it would be really helpful to have your guys' thoughts on that too.
Thank you, Claire. Congratulations.
Thank you.
And you're right, that's a lot of money.
It is. And then real quick, the Crisis Coalition that was just formed, the North Central Crisis Coalition, I'm on they broke all of us up into groups to work on different areas, and I'm in the regional training and resources group. So what that means is we're trying to compile all the trainings and resources that are within the North Central region. So it's going to be health departments, a lot of health departments working together, a lot of counties working together just to share. Part of that is I'm currently trying to update our 211 resource online list. So if you go online to 211 and you put in Teton County, I'm trying to clean all that up.
So that group, so again, that's our 8 county and 2 tribal region working on crisis diversion. We just completed a strategic plan, got together and did a strategic plan for that group. And so that's part of those strategies in the strategic plan are, like Claire said, working on resources and like regional trainings that we could be doing.
988 is a different section of them too. Sorry, go ahead.
Yeah, that's okay.
I'm trying to think of it.
Yeah. Yep, 98, like rolling out 988, making sure everyone has the tools to get that more utilized in their communities, data collection, working with law enforcement, hospitals to collect more data around crisis so we can be a little bit better informed about what the situation is. And then sort of some governments collaboration working together are, I think, the broad categories that came out of that strategic plan. So we will continue to work forward with that. That's funded under a grant through the Montana Healthcare Foundation, and that grant is housed out of Ponderay County. And we have that. I think we're just wrapping up year one. It's a 3-year grant. So making some progress there. Thanks, Claire. Any questions about anything behavioral health related? Okay. Brianna, did you have anything else you wanted to share about chronic disease?
Sure.
I mean, I can talk about the funding piece, but
Okay.
if I just didn't know if you had anything else.
Yeah, I can just share a little bit of what we have going on with chronic disease. We started our new diabetes prevention program. We call it Healthy Tracks, because anyone that's wanting to be healthier or exercise or get more nutrition information can join. We started the beginning of March, and we are going strong. We've had a lot of good success, and I always have my core group that repeats the class every year. It's about 10 people, and this year we've gained a few. So each year I get a few more that really stick out the class, and they have good results. And year after year, there's that core group keeps losing a little more weight, having a little more success with activity and stuff. So it's good to see and fun to have them in there. And it's interesting to find out the new information, even though it's the same information. So that's been great. And we've had a lot of different people come and talk at the class. So I've had Christina Skinner, she's a dietitian, she came and talked. I had Tammy Smith, she's a counselor, she came and talked. And then I've had Paul Bradbury and Cherish. So both of our clinics were represented there, come and talk about diabetes prevention. And then Cherish talked especially about her experience with diabetes and being a diabetes focused practitioner. So it's been really great to have that involvement as well. So there has been new information this year for sure. Yeah, and then I'll let Melissa talk about our funding changes.
Yeah. So at the last meeting, there had been a question about how are we being impacted by changes at the federal level with funding, and at that point we really hadn't seen much. Although, I think right around that time, actually, right after that, we did lose so Claire is currently funded under a prevention specialist grant that we subcontract from the Alliance for Youth. We were an expansion site, which was related to increase in funding during the pandemic, and we've been informed that is gone. At first we thought they were like, you're losing your funding as of 2 weeks ago, but then the state stepped in and said, we'll actually complete these contracts. So we still have that funding for behavioral health work through the end of September. So this near-term initiative grant could not have come at a better time. So we're very fortunate to be able to consistently continue the work that Claire is doing. Then the only other place where we've really felt a big impact is in our chronic disease area. So we receive what's called a coordinated contract that includes our diabetes prevention program, our tobacco money, our cancer prevention money, they call it it's like arthritis prevention, falls prevention, and then in the past that has also included like the Connect referral system. Is that all of them? I think that's all of them. It's a lot of different, funding a lot of different programs gets all dumped into one grant, and then Teton County receives that grant, and we subcontract out to 5 other counties in north central Montana, so they receive their money. So it comes to us first, and then we pass it on to them. We've been seeing some cuts to that funding actually over the last few years. We were informed pretty early on that the Connect funding would not continue, and that's not just with us, that's across the entire state. No one's going to continue the Connect funding at this point in time, but they're hoping maybe it will come back in the future. So that was no surprise that we wouldn't be getting that. And then just a few weeks ago, we were basically informed that the state lost all of its federal tobacco money. So the state still has its own funding from the tobacco settlement from however long ago. So we have been, and also in addition to that, the legislature approved $1 million increase to tobacco funding this last year. So we have been informed that the tobacco funding will stay level for this next year, but that is the only one that we have any certainty on. So diabetes, cancer, those sort of falls, arthritis prevention, falls prevention programs, we've basically been told it's all up in the air. The state's plan, we usually have our funding numbers by now because every county is working on doing budgets this time of year. We have no numbers. So we're basically being told that the county, or that they will give us a partial contract for the year. So I don't know if that's 6 months out or 3 months out or whatever, but they're going to basically say, okay, we're going to fund you at some level, which again, we don't have our exact numbers yet. And then we'll see what happens at the federal level, and they will have to do an amendment to continue that throughout the year. So it feels very precarious right now. If the state is going to put out task orders for us, I think that's their commitment to making sure we're getting at least, like, they're filling that with state dollars if they're not going to get those federal dollars. Although I guess I don't know that 100% for sure. I don't think they've put it in those words. But that's how I'm perceiving it, is that the state is going to provide us with at least some funding, but at some point during this year, we could hear that a bunch of these programs are just gone. So.
And the state has said too, they're trying to prioritize the counties over state employees, but they still have to keep some state employees. Yeah. So they're working through all of that, but there's a lot of uncertainty, and all of that, maybe not all of it, but most of that funding comes from the tobacco tax. So that's set aside from the Montana tobacco tax for the tobacco program. And then it also includes some of those chronic disease programs and helps fund like CHIP and other things. So that money's still there. It's still coming in from the state level. We'll just see what federal looks like.
And I think that what we're hearing from this folks at the state, and I will say they are, actually our state health department is really phenomenal about running pretty lean in order to pass money on to the local level. Like that is something that we see them do often, to prioritize, like, folks like Brianna, who's doing the work in her county, right? Which is great. And what they're telling us is that some of the places where that funding has been housed in the past, like those entire departments are gone at the federal level, and so, but there hasn't been notification of, okay, is this program going to get picked up and just moved to somewhere else, or is it just gone completely? So they're really struggling to get answers from the federal level, and which means they can't really provide us with information either. So we're all just, hanging in there to see what happens. It's a pretty big contract that we bring in, but again, remembering that goes out to a 5-county region, but it's usually in the range of like $350,000 a year that is with all of those chronic disease programs together. So we will just try to remain nimble and roll with the punches. Any questions about that? Okay. We can move on to communicable disease and immunizations. So flu and COVID seasons have more or less wrapped up, as well as immunization season for those. We I think around the end of May, pretty much had used up all of our COVID vaccine. It outdates probably this week anyway. We did have a few people roll in looking for COVID shots in June, which surprised me a little bit, but that's okay. We were able to accommodate a few of them, and then we just basically ran out and didn't order more because it was going to expire anyway. And just told folks to wait till the next round comes in for the fall. But I definitely think we're seeing a decrease in our numbers. So not as many people vaccinating for flu and COVID as we have seen in the past. In terms of our numbers for for illness, I think it wasn't a terrible season for us for flu and COVID. I mean, we had consistently, maybe a couple of COVID cases a week. Again, these are the ones that get reported to us, so you have to be sick enough to go in and see a provider at this point. And then we did have some early outbreaks for COVID in our long-term care facilities, but I don't think past January, February, I don't think we've had any more of those, which is great news. Then in terms of measles, fortunately no cases in Teton County yet. I think the state is up to about 20 cases across 4 counties, Hill, Gallatin, Flathead, and Yellowstone counties all have measles cases. I think Gallatin just announced the 13th case yesterday, maybe. So, spread out. Definitely all the corners of the state, right? We did move so we've done a few things just to prepare, and I do feel like we're actually, not that it won't be a lot of work, it will, but we are fairly ready to fairly prepared. Like, we've had a lot of the early conversations with healthcare providers. We have testing capacity at BTMC lab and at Frontier Family Practice. We're trying to push out lots of information to encourage if anybody has symptoms of measles to call your healthcare provider before you go in for a test. That's one of the pieces of information we're really trying to push, because that's where we've seen in other locations a lot of exposures can happen as somebody walks into a busy waiting room and there's a bunch of other people in there, and then everybody gets exposed. So I think our testing locations have the ability to test folks actually out in their vehicles, which is great. We did have Gary sign some standing orders that allow for us to vaccinate on an accelerated schedule. So this would be for children under the age of 12 months and children under the age of 4. Routinely, you do first MMR dose at age 1 and the second dose at age 4. But we do have orders in place now that allow us to do that population between the ages of 6 and 11 months, and then the second dose can actually be done. It just has to be 28 days after the first dose. And we've seen pediatricians too, like Dr. Amthor, I know, has started recommending that accelerated vaccination to some of her patients. I would not say we're quite to the point of making the recommendation that people do an accelerated schedule, but it's nice to have that as an option available to folks, knowing that there is measles in, like Flathead, neighboring counties, that kind of thing. So, so that's sort of where we're at this point. If families are concerned about it, they can come in and do those accelerated vaccinations.
So did the recommendation to change that come from the state then, or?
No.
It was just a
conversation we had with Gary.
A county decision.
Yeah, it's a county, and the state has made it very clear they will not. I mean, things would have to be pretty dire for them to make the recommendation to start vaccinating people on an accelerated schedule. The CDC basically says if there's 3 cases in an area, then they would start to recommend an accelerated schedule. And so really we put this paperwork in place to have to be ready in case we get to a situation. And like I said, I wouldn't say that we are recommending that people vaccinate on an accelerated schedule, but the option is there, and we're encouraging folks to have a conversation with their healthcare provider and to make a decision about what's right for their family in this situation. So
you don't have to wait for anybody to make that recommendation. You guys can make that decision on your
Yeah, yep, I mean, the vaccine is, it's all, the vaccine is licensed to be used that way. It's just, this would be, it is slightly off from the ACIP recommendations.
I don't have a problem with it. I'm
Yeah.
just wondering
Yeah.
where that.
Yep.
I'm gonna go. Thanks, guys.
See, Claire? So, Melissa, my friend has a daughter in Missoula who has probably a child 6 months old, and she really wants him to be vaccinated. So would she contact her health department or her pediatrician about the accelerated?
Yeah, yes, both, either.
Okay.
Yeah, I mean, I would definitely recommend that everybody talk to their
Yeah.
healthcare provider specifically about their situation. Yeah, yep. But like, for example, right now in the state, Cascade County has had a bunch of exposures, and they started recommending an accelerated. And I don't know that they've had any cases come out of that exposure, but it was in a big office building with a bunch of different offices, you know, and so there was an exposure within that building, and they started recommending an accelerated schedule. Hill County is currently offering or recommending an accelerated schedule because they had their exposure was a lot of unvaccinated individuals, and so they're aware that there were a lot more exposures than they knew about, or that were like willing to communicate with them. So they just basically put that out there. You know, so several counties are on an accelerated or offering an accelerated schedule right now. And again, the state has decided they're not going to make that decision. It has to happen on a county level. Yeah.
I mean, my receptionist has a, you know,
Yeah.
young new, and she's working in healthcare where
Yeah.
she could get exposed anytime. So
Yeah.
I'm good with it. I
Yeah.
just
No, it's
wondering
a
where
good
that-
question though, and so yeah, no, we're probably not going to see anything. I mean, it would take a lot for the state to step in and say we think everybody should be doing this now. It's really going to be a county by county decision.
Okay.
Okay. Any other questions about measles or communicable disease?
So, with all the changes with immunization at the national level, so I guess that kind of falls in with my question before, you know, are you gonna follow the CDC recommendations as things come down, or how does that work? Are all your
That's a good question. So with the shift in, you know, the ACIP board, we are a provider of the VFC program. So that means we have state-funded vaccine. And as part of that, it is a commitment to following those ACIP recommendations, as I understand it. So,
but yet with the measles,
yeah, so I guess I don't know, Carmen. Like I don't know if things will change. I don't know if the vaccine schedule will change. I don't know if I guess it's a commitment to offering all of the ACIP recommended vaccines for the VFC program. I don't think there's an issue. Like this is not like this accelerated schedule is not unheard of, and there is ACIP recommendation around it, right? In terms of what that schedule will look like going forward for kids, I don't know.
yeah. I mean, I don't think it's an issue right now, but
Things function a little bit different in, you know, when you're talking about, like, you know, we're not an outbreak status by any means, but like when you're talking about that, but yeah, I mean, I guess I don't know. I don't know if the schedule will change. I don't know if we will be put in a position where we will be following a new schedule put out by the ACIP. The one thing I was going to talk about is the recommendations around COVID vaccine did change. So COVID vaccine is no longer recommended for pregnant women, and for healthy children, the recommendation is now, it's what do you call it, like a Schedule B recommendation. So it's essentially like a conversation with your healthcare provider to decide if you should vaccinate your child or not. Doesn't mean we can't offer it to people. Doesn't mean they can't get vaccinated for COVID. It's just how that recommendation is worded is different. It's not routinely recommended to every child.
But they can ask their healthcare provider.
Yeah, I know, and we can still provide it to them. We just basically say, okay, I mean, the recommendation, and it's actually the same for like meningococcal B for like kids going off to college. It's not a flat recommendation that every kid get meningococcal B. It's just that they're supposed to talk to their healthcare provider about whether or not they should do it. And I'd say a lot of college kids opt to do it. They want to do it. So,
I have a question, Melissa. So, when I was director of the health department, we had great immunization rates, as did most counties throughout the state of Montana. Over between 90 and 95%, which is what the target was, and it was really easy to get people to vaccinate. And have you seen what's the percentage right now? Do you have any idea?
well, it's very hard to say because the Montana legislature decided that they would no longer report congregate immunization rates to the federal level. So we don't know. We're the only state in the nation that doesn't report like our immunization numbers, and they tried to change that in the last legislative session, and I believe it was tabled. So basically, like, there's kids who are attending school have to have a vaccination record or an exemption in place. All the schools used to have to report that to the state about what the rates were, and then that would get collected at the federal level. Schools no longer have to, they still have to have those records in place, but they no longer have to report that to the state. So the best numbers that we have to go off of are like the immunization registry, because most people put their vaccinations in the registry. So we can pull numbers from there, but it's really hard to know, because if you're not vaccinated, you're not in the registry, right? So I'd say Montana is quickly falling into a situation where it has very poor data on population level immunization rates. And I don't know off the top of my head. I can pull
That's okay.
I can pull our Amtrak's data for you if you're interested. Like, it's pretty straightforward to get those reports, but again, it's only the people who, it's not even just Teton County, it's just the people who vaccinate with the Teton County Health Department. Which is not everybody in Teton County. A lot of people are vaccinating with their pediatrician or in Great Falls or so. Yeah, without that school data being reported, it's really very hard to say. Good question. Katie, do you want to talk about this stuff?
Yeah.
Oh, sure. Yeah, sorry. I didn't realize that's what it was for. I'll give you guys, that's Katie's report for financials here.
I'll give you one. I'll help you.
I think there's only enough for the Board of Health members, but
Our reflexes aren't the same as they used to be.
this is reflective of the current fiscal year. This is how much billing I sent out and how much will come back. We calculated out that we're in the positive 10,000 from our purchased vaccine. And yeah, there's still just the correction part is still definitely a process, but I feel like I was pretty pleased with with the percentage that came back without too much correction for October. That was pretty good. Yeah, any questions about that one?
Do you find you get reimbursed pretty well?
So some of them reimbursed at 100% or even more. Like, it's been interesting to see which ones will reimburse. And it makes me want to check our prices a little bit on some of them. But I would say the majority is slightly under what we request. Anywhere between I would say 75% under. So if I sent out a bill for $42, I would get probably about between mostly 37, but sometimes it would bop down to $28.70. And then for the fee for the nurse, I bill it out at $40, and I see anywhere from $13.75 to $40. And I would say closer to 33 for that to be how much gets kicked back for it. It depends on the insurances, how much it gets back. Medicaid is only ever just the $21 for the nurse fee because we use the state allotted vaccines. Medicare, I have to bill Medicare for there's only 2 that actually bill through Medicare. The rest is billed through this Part D program called Transact, and Transact pays a flat rate of $20 for the nurse's fee, and then it pays pretty well for the most part for those other vaccines for Medicare. I feel like Cigna is pretty much always at 100%. Blue Cross Blue Shield, it depends on what one they have. That one seems to be the most varied in the response there. That one and Allegiance, I feel like, are the 2 that I have the most broad range of how much is getting kicked back, and I have a little bit less of ability to guess on that one of what it's going to look like and be correct.
So what's the most significant number on this?
So if you'll just lay it down here, I'll kind of point it out. So what my goal is this one. I want this one to be at 85 is kind of my goal. This one is without the adjustments. This is just the flat percentage. This one's how much is left on each of the accounts. But this doesn't. This also includes though ones that are private pay, or this also can include things that need to be corrected. And so sometimes this feels a little skewed, but it's a good indicator. This is the adjustment. So this is when they kick back and say, we're not paying this. This is what's adjusted off of it, off the top. This is how much we've brought in. This is how much is potentially out there. But again, that number is a little bit false because if I get denied, even though it shouldn't be denied, that'll go on to this charge amount, right? So it's, so I would say this number is handy. The balance, I use this number, and this number are probably the 3 numbers that I use the most.
So that third column, that's basically what you can use you can put back in your budget.
So the third column, so that's how much I brought in. That 185 is how much has been paid out to the health department. So we spent $175,000 on vaccine the last fiscal year, and so we brought $10,000 more in than paid out for vaccine at this juncture. Obviously, I'm hoping for more. Corrections are just kind of an always happening process. I definitely have with the added stuff from Marcia and learning those things, I feel the last 2 months or so I've not had as much capacity for corrections as previously because of just learning the stuff Marcia left behind has definitely impacted that.
So is one of these columns the money that you earned?
The 185. That's the money we've brought back.
Oh, okay.
Yeah.
And you can use that to fund health department programs.
They gotta pay for their vaccine.
You pay for your.
Yeah, so 100, so far, based on what we've vaccinated and billed out to insurance, we've brought in $185,000. We have spent $175,000 on purchasing vaccine and necessary equipment to administer vaccines. So it's not a huge moneymaker.
No, it's not.
Thanks, Katie.
But it's good to see it in the positive.
Yeah, at least we're not losing money.
How does it compare to last year?
Actually, I'll pull it up.
I did have Katie just pull this report. It's down significantly from last year. And again, I think this is related to vaccination rates. We're vaccinating fewer people. The bulk of this is for flu and COVID. I mean, a huge amount of this is for flu and COVID shots, which you can see reflected in October through January, basically. But
last year, I do remember my total amount that I brought in was $217, something like that.
Yeah.
And so my goal is at least getting close to that. I can pull that up really fast. It's really handy. This EHR has a report system, and in that report system, you can change it to month to month or year to year. And so when I'm doing corrections, I pull the month to month. And then I look at the specific days and pull up the accounts for that day and go from there. That's how I dig into that one. And then I just my phone.
And as I'm thinking about it, Ken, some of that might have been not this season, but the previous season that RSV vaccine came out for folks over the age of 65. Anyway, we did a lot of those that first round, and that's a very expensive vaccine, and the reimbursement's pretty high for that. And then, of course, fewer people because at this moment it's a one-time vaccine. So that could have contributed to some of that increase as well.
And I'm just pulling it up. I'm going to connect my hotspot fast.
Katie, you're computer savvy.
Something.
I don't think we did these things when I was there.
We didn't have the ability. I mean, honestly, this is a like
Good.
moving to this EHR is it's been a lift, but it's amazing to have this kind of data available to us because we just
Yeah.
didn't have it before.
Yeah.
So it's a new thing that's why we keep telling you guys about it, because it's a new thing that we're actually able to track how much money we bring in,
'Cause I was thinking that $186,000 was payments that you could use to supplement your budget.
Oh, yeah, it
Yeah.
is.
But it's not.
Sorry, my hotspot's a little slow.
That's okay.
It's pulling up.
Come on.
Is there another guest network here?
I didn't see it.
I can hop over and, are you close? Do you
It's
wanna-
okay. Yeah, if you wanted to try
I
it, 'cause
can-
it's like being really silly.
Oh, okay. Well, I think we can send out the previous year's report too, if that's okay with you guys. And then you guys can just have the numbers. We can just email it over to you. But it was more than this year that we brought in. Do you want to talk about the FET plans?
Yeah, and so here's our two FET plans for this one. They were emailed out to you. One is the non-pharmaceutical intervention plan, the other one's the pandemic influenza plan. Did you guys have anything pop out? I need your signature, Sam's signature, and then Gary's signature on them for our FET deliverables. Any questions on them or any thoughts? Especially if you have thoughts, that'd be great.
I didn't hear what we're signing.
Sorry, you're signing, this is the non-pharmaceutical intervention plan and the
Oh,
pandemic
so-
influenza
yeah,
plan.
I
Did you
took a-
guys have any thoughts?
I took a quick look at it this morning, and the links weren't working on some of the
okay.
legislative stuff. So I think what's happened, they update the legislation, and so we just need to check the links.
You're talking about kind of in that first summary there.
We're talking about the non-pharmaceutical intervention. Yeah, there were
Yeah.
multiple links, that
Okay.
we could highlight, and I tried a few, and they weren't popping through.
Okay.
Because it wasn't.
Something's
the-
changed.
The legislation wasn't updated on the links.
Yeah.
It's just
Okay.
something to do on it, so.
Okay, I'll double check
So
those.
Katie, this hasn't been updated since December 2022.
No, I think the last update that Marcia did was adding Illuvian to it.
Oh,
This is
but
23 though.
But so and
Yeah, maybe
it
didn't
so it
put
is
the date.
it is actually listed in the record of revisions. I see that, but it looks like we missed updating the date on the bottom.
I'll fix that.
So probably on both of those it needs an update. No, this one hasn't really been touched since 2016. 2018 review by the Board of Health. Okay, so we can update those to today's date. So do you want signatures on this page, Katie, or do you want to wait?
I can come in and sign it when you got.
Okay. Sam, would you mind doing that, coming in and signing it after I do those two updates? Okay.
Yeah, or he's pretty easy to track down.
Yeah, that's true. Okay. Perfect.
Yeah, I wouldn't say major changes to these.
Anything else that popped? Is there anything else? Okay. I have just quickly gotten that yearly report from that last fiscal year pulled up. And that one, we brought in $232,840 by the end of the fiscal year, with the remaining balances. Oh, the remaining balance is a little weird with this because after the year is done, I do cleanup because I don't want to leave open accounts. So it's like quality, I just want to do some quality improvement on the back end. And so it's harder to track the actuality in some regards. For the most part, on this side, I do check the GCR to get close on that one. And in that one, the average was between like 77 to like 100%. But the total brought in was 232.
So that's your charges or payments?
That's our payments. Our charges was 274. So we had an adjustment of 41,000 about. Spent a lot of time on the phone. Like a lot of time on the
You're a good
phone.
hunter with insurance companies.
Yeah,
That
yeah.
is- that's awesome.
I think my record was like, it legit was like 4 hours with Cigna. It was, yeah. Okay, so I'll update the date on the bottom and then check the links. Any other adjustments? No other adjustments for those plans? Okay.
Sounds good. I'll be really quick with these last couple of things, but I just wanted to draw to your attention that we have finally published our community health improvement plan. It is up on the county website. I think it's a little too big for me to email, but I can definitely email you guys the link to get to see it. But I think it turned out really nice. We had some great community participation via some in-person meetings, Zoom meetings, surveys, all kinds of things. Essentially, we came up with 2 priority areas. So one being behavioral health and the other being family and social supports. And we have some objectives in there. It was sort of interesting to me that a lot of the strategies that the group came up with was really around building more community connection, making more opportunities for people to connect with others, both in terms of, addressing, sort of a behavioral health from a prevention standpoint, but also just providing support to people across the lifespan. So anyway, I'll let you guys dig in a little bit deeper with those, but overall it feels like a pretty good chip. A lot of great stuff to work with from here, a lot of room for partners to be part of it. The way we did this one, we had technical assistance support from some folks at DPHHS out of the Public Health System Improvement Office, and so we sort of used their model to build a chip, and they create strategic directions in addition to priority areas. So our priority areas being behavioral health and family and social support, and then we had sort of strategic directions in terms of how would we address these things across these priority areas. And so one was generating support and connection, and a lot of that is like, how do we get people more familiar with the resources that we have? How do we build better connections? And then the other one was sort of this increasing professional capacity. So some of that is around like better training for those that are working in the fields that are addressing behavioral health or family and social supports, utilizing, teaching folks how to utilize the tools that we have, universal screenings in the healthcare setting, that kind of thing, utilizing telehealth as an option for this community, because it's, of course, always going to be challenging to have enough providers, whether that's mental health, healthcare, whatever the case may be. So trying to increase the capacity of the professionals that do exist in our community. So, any questions about the chip? Okay, and then the last thing I was just going to make you guys aware of, and I can send this out to you as well. So there's a new group called 21C, which is, I sort of put this under pathways, but actually I'm going to kind of talk about it in a broader context. So 21C, Montana 21C is an initiative that was put out by the Public Health Accreditation Board on a national level, and they are encouraging those that are in public health, at any level in the public health system, to be working together to sort of try to transform the public health system, to rebuild trust, to strengthen the systems, and whether that's looking for funding increases or delivery of services on the local level, that kind of thing. They have been encouraging folks to just be part of this. Montana has the 21C is it's actually stands for 21st Century Public Health Learning Collaborative. So 21C is the shorthand. But it's several different states across the nation that are working together, or working, not necessarily together, but learning from each other in terms of how they can transform their public health system. So in Montana, some folks from DPHHS and the Public Health System Improvement Office went out and they surveyed every state, every county, and every tribe across the state of Montana. And they collected a lot of data. It was like 136 questions on how we are delivering the foundational public health services, which is essentially just a framework of what should be available to any community member in any community across the entire nation in terms of public health capacity and services. So Teton County was, obviously we were surveyed. It's kind of like a self-assessment, like we were the ones answering the questions in our ability. I will send this out to you guys so you can take a look. And I think what we learned from this is that obviously larger health departments have higher capacity to deliver these foundational public health services, the smaller a health department gets, the more, gaps you start to see in these foundational public health services. There will be a statewide conversation with, again, partners at every level. So local partner, like local people who work in local health department, state health department, public health, Montana Public Health Institute, Confluence, the universities that have public health programs, like everyone will be, all of the partners will be part of these conversations to kind of come up with some strategies as to how we can improve the delivery of foundational public health services. They're really emphasizing that this is in no way meant to be like a punitive approach. Like they were very careful about how they put this out into the world. Some health departments are doing more than other health departments, and that's just the way it is. Some health departments are one half-time person, it's unrealistic to think that they'd be able to do all of these things. But this is sort of up on the screen. This is sort of Teton County here. So some things, the black is what we're doing pretty much at, a 4 means that we're formally and routinely delivering it. So we're doing it consistently. We have policies written. We have everything in place to do it consistently. So in our case, a lot of things that we're missing are written policies around how this stuff happens. It's not that we aren't doing it. It's just that maybe we don't have it written down. And so we are participating in, as I've told you guys before, the Pathways program, which is related to public health accreditation, and we're getting some funding and support to go through that. And I'm actually really excited because when I look at this, I think, well, a lot of the things that are in here will be naturally improved as we go through the Pathways process. So I think we are actively working on making some improvements in this area, but there's also this report, like that I said, I will send out to you guys, includes, statewide data or comparisons to the state's data as well. So anyway, it's an interesting thing. I'm sure they will continue to reassess all of us over the years and see if we can start to see some improvements. And so it's good for us to know for Teton County, but also to kind of see what's going on statewide. So that was a very fast explanation of what 21C is, but any questions about that? Okay. I just want to keep you guys informed about what we have going on. So, Austin, you got some?
Yeah, so we brought up HB 853 earlier. That's an increase in the retail food, not retail food, basically all the public health licensing fees that I inspect. Some of them are pretty substantial. It's anywhere from like 75% increase to over double. For example, like an Airbnb that's going to usually cost people $40 for a license, which is cheap. That's going up to $100. One big aspect of that is going to be our restaurants. They're usually split up into two categories right now, small or large. If they have 1 to 2 employees at a time, they're small. If they have more than 2, then they're large. They're creating a new category for medium. So it's going to be 1 to 2, 3 to 9, 10 plus. I don't think we're actually going to have any that are considered 10 plus. So, we're just going to be having small, medium. One of the bigger ones that doesn't really affect us too much is public accommodation. So hotels, if they serve food at all, they have to have like a restaurant license. Stage Stop, they do that, but they already have the bar license, so I'm just going to fold those in together because it's really not feeling like separate inspection. I already do their commercial kitchen anyways. And then Boone and Crockett, they're a campground over by DePuyer. They've got the same thing going on, but they already have their license. So it's nice that we're kind of already in compliance with that. That's going to happen October 1st. Everybody with a current license, they're good through the year though, so they're not going to notice until it comes to renewal. But just want to let you know those license fees have gone up kind of substantially. It's not a huge amount of money. So retail food, the small one, which is probably our most common one, it went from 85 to 150. So in terms of operating costs, it's not massive, but it is relatively a big increase from what it has been. And I've got those numbers here if anybody needs them. Some of the other legislative ones was for septics, essentially a septic system is given what's called a mixing zone, which is like typically a 100-foot buffer where you're allowed to pollute. You don't want to have any kind of well there, but it's basically saying, yeah, if we sample this ground or the wastewater here, it's gonna not be suitable for basically our Montana Water Quality Act. But at the end of that 100-foot mixing zone, it should have reached the filter or treatment that it needs to qualify. The difference with this one is those mixing zones aren't allowed to go off your property anymore. It's going to be a little bit more complicated than that, though, because if the lot was created before, I think 2011, then it's still going to be okay, because we don't want to essentially make lots that already exist useless because they're too small to accommodate that. So that's going to be a little bit of a headache, but
So they're
overall,
only gonna grandfather in lots that were made before 2011?
I'll look into it. It doesn't make a lot of sense. I think maybe in 2011 is when mixing zones started to be like
Okay.
put into place for like the DEQ and should be for the county COSAs.
But still, it feels like if it wasn't in place that they
Yeah,
had to
I
be
don't.
on your lot, that could cause a lot of problems.
It could. But new subdivisions now, they're definitely going to be keeping those on their property. And it makes sense if you think about it too, because you shouldn't have to put your well depending on where your neighbor put their septic system. Everybody should be trying to stay self-contained. And if the lots are that tight, then really easements can come into play and should come into play for that, which it allows for. The other thing to talk about is we got 4th of July coming up, and I've had a lot of more interest in the Local Food Choice Act this year. So if you don't know about it, Local Food Choice Act allows people to sell homemade products, not including meat, to the public, to an informed end consumer, which means somebody that knows it's homemade, it's not subject to inspection, and they can sell it either out of their house or at these traditional community events. So I double checked with the state just to do a sanity check because I was pretty sure, but I wanted to make sure. 4th of July, Fairfield Swim Days, the Choteau Winter,
Dutton Fun Day.
Dutton Fun Day. Basically any of these pretty common events. You definitely could start seeing more people pop up with homemade food. The expectation is that they're making consumers aware, whether that's a sign or something like that. So it shouldn't be a surprise if they're not inspected, but and they shouldn't be doing any meat. But those are kind of the two big criteria that I've been going over with people. Let's see. The last thing is I got a complaint about, and I don't think the board does too much with junk vehicles, but Pendroy, they had the Sheelers wrecking yard out there. That's been closed a while, but the cars are still there. I got in touch with the guy that owns it now. Well, actually, the Sheeler's son initially was going to sell all those cars to a junkyard in Conrad, and that just didn't happen. They never got picked up. And so I got a complaint about them, so I spoke with the owner and told him, you know, it's time to start working on these. He's been slowly getting through them. I think it's just been doing a couple of cars to Great Falls for the scrap metal at a time. So if he's still making progress, I'm not going to get the DEQ involved, but if it seems like it halts, then we'll start doing enforcement on that. But hopefully we can get that lot cleaned up, because it's no longer a junkyard, and so it's violating the JV laws that we have, which say you're not allowed to have junk vehicles in public view of a road. But I think that's everything I have. Do we have any questions on any of that?
The increased fees, does that go to the county or does that go to the state?
So, yep, that goes to the county. It's gonna be a modest increase for our general fund. It's not I don't think it's a huge amount that we end up getting, but,
So each Airbnb gets $100 a year, that's a per annum, is that, and what is that?
so each Airbnb pays a $100 license fee to the state. The state gives a portion of that to the county,
Got it.
after they do an inspection.
It's not that you don't have to go and inspect Airbnbs, do you?
That one's
Because I didn't know that.
No, that one's actually a special one. They get an inspection at the start, and then they get inspected upon complaint. They're the only license I have that does that.
Oh.
All the other ones are yearly inspections. And the general fund gets paid out after I do the inspection. But the Airbnbs, we just get those for free if there's no complaints.
They continue to pay the license fee every
Yep.
year, but you don't re-inspect.
Yeah, they don't get an inspection. Yeah.
Didn't I have inspection?
I've definitely seen a couple of Airbnb closures too. People that didn't renew, and I reach out and they just said it wasn't worth it for them. But also, I've got more people trying to do it too. So generally, it's a growing industry still.
And I think the push behind updating these legislative, or these, the legislature updating these license fees was in bigger counties, you know, the fees were so low that the time that it was taking and all of that was, it's all coming out of the general fund of the county, and so.
Yeah, it was definitely a big county pushing, or big counties pushing for it, just because they get significantly more if they're doubling their license fees.
They hadn't been updated in decades.
Right, it's been a long time.
Yeah.
I was reading this report.
Yes.
That they actually worked on this over the course of the interim break with the restaurant, with the Restaurants Association in regards to increasing the fees. So I thought that was nice. I thought that was a positive move.
Yeah, I mean, personally, I don't think it's too surprising. The Restaurant Association tends to be bigger players are part of it, where going from 115 license fee to 275 just a drop in the bucket for them. Usually the ones I'm worried about are the really small operations that are just getting started. But again, I mean, if 65 or if $85 is going to be the difference between making or breaking the business, then you probably don't have the equipment to run it to start with.
Anything else? Okay, thanks guys.
Thanks.
Thank you. Yeah, something, huh? Yeah. Thanks for being here, Andy.